Good afternoon, everybody. I join with my colleague in welcoming you all once again to this webinar titled Elimination of Trans Fatty Acids from India by 2022, Challenges and the Way Forward. We have almost five eminent speakers who will be speaking in this webinar. And also we have more than 100 people registered for this webinar from Kerala to Delhi and Tripura and Assam to Mumbai. And also we have a couple of colleagues registered from outside India, from Bangladesh, from Ivory Coast, from Brazil. I hope they will be able to join with us, though the time difference is there for some of them. Before proceeding, like my colleague had mentioned, I request all of you to put your mic muted and also to switch off the video because some noise is coming in between. As all of you know, the world is going through an unprecedented crisis as a result of the pandemic. And all over the world, about 19 million people are affected, and about 7.11 lakh people had lost their life. And India also, about 1.96 million people are affected, and more than 40,000 people had lost their life. Various studies shows that people having comorbidity, that means multiple health conditions simultaneously, or people are having pre-existing NCDs are more vulnerable to this COVID-19, or they are at high risk. So various studies were coming out in the previous months. A study, a WHO study, which was released on June 15 in USA, says that people with comorbidity is having 6 times high chances of getting infected and 12 times high chance of losing their death. This is the data only of US citizens. And out of all the patients infected, it shows that 32% of the people are having cardiovascular diseases, and 30% are with the diabetes. Like this is the data with regard to US. Much before that, at the beginning of the pandemic, the WHO had done another study. It shows that out of the total death rate of 3.4%, people having various NCDs, 13.2% of the people are having cardiovascular diseases, and 9% are having diabetes. So what I want to just mention that, this data shows that people having pre-existing NCDs are more vulnerable towards the corona virus. And moving forward, what is the condition of NCDs? WHO study shows that 70% of the total death globally is attributed to NCD, which is resulting in about 40 million people losing their life. In India, 61% of the total death is caused by NCD. These also about 3% are premature death, resulting in about 5.8 million people losing their life globally. And out of this, 45% are having cardiovascular diseases. With this background, I am coming to our issue of trans fat. As all of you know, trans fatty acid, this is mainly the partially hydrogenated vegetable oil. Mainly the forms that we can see in India are the vanaspati, margarine, bakery shortenings, and things like that. And mainly the product with high trans fat is the bakery products and microwave popcorns, or a lot of things are there, or deep fried items and things like that. So what is the main problem with the trans fat? Various studies shows that 2% energy intake from trans fat is resulting in 25% increase in the cardiovascular diseases or death. Or in other words, 1 gram of extra intake of trans fat per day is resulting in 5% increase in the cardiovascular diseases or death. So this is also trans fat also mainly contributing towards the increase in LDL, what we call the bad cholesterol, and resulting in the reduction of the good cholesterol, which is the HDL line. So various speakers will be talking more about this, so I'm not going into the details of this. So realizing the danger of trans fat, our Ministry of Health and even FSSAI, even much before the authority came into existence, itself had started various measures in regulating the use of trans fat in the country. In November 2009, the FSSAI came into existence. In 2011, the Act came in 2006. The FSSAI had set the limit of trans fat in India 10%. Then later in 2014, the limit was set to 5% to be achieved by 2016 end before 2017. So these measures were taken. Then in the recent past, as all of you know, in May 2018, the World Health Organization came with the replace, which is the step-by-step action plan to eliminate the industrially produced trans fat from the global food supply. This is the abbreviation of various actions to be taken. Then immediately after that, in India also, the FSSAI had announced in June 2018 that even 1 year ahead of the WHO deadline, India will achieve the target of elimination of the trans fat or reducing to 2% by from 1st of January 2022. So various legislations were amended accordingly. Finally, in August 2019, the Food Safety and Standards, Food Product Standards and Additives Regulation of 2011 was amended to set the 2% limit by weight in oils and fat. The draft regulation was announced, and we are just awaiting for the Gazette notification of this particular regulation. So in this context, is this webinar organized? As I mentioned, various people are having vast knowledge in this sector, are participating in this webinar. So now I will introduce the speakers one by one. We have Dr. Sunil representing the Food Safety and Standard Authority of India. He is the head of the regulations and the codex and international cooperation at FSSAI since 2015. For the last 5 years, he is working with FSSAI, and also he is having almost 22 years of work experience in the food and the dairy sector. So we welcome you to the webinar. Second, we have Dr. T. Longwa. Dr. Longwa is the Director Grade Scientist at the National Institute of Nutrition based in Hyderabad. His research interest is on food consumption, indigenous food system, macronutrient, etc. And at the NIN, he is also part of the team for Indian composition data maintenance, and also his book, Indian Food Composition Tables, is used globally. We are happy that Dr. Longwa will be joining with us in this webinar. I welcome Dr. Longwa also to this webinar. Dr. Aram S. Rao. Dr. Rao is an associate professor of food technology at the Paskarajaya College of Applied Sciences under the University of Delhi. She has more than 25 years of teaching experience, and she is also an empaneled expert with the FSSAI for content development, training, capacity building, etc. More than that, she was also the technical expert with the World Bank on elimination and reduction of trans fat from Kerala, mainly from the bakery products. We welcome Dr. Aram Rao to this webinar. Dr. Rachita Gupta is the National Professional Officer Nutrition at the WHO country office, and she is also with WHO for the last 5 years. Dr. Rachita is a public health nutritionist with over a decade of experience. At WHO, her portfolio includes advocating on nutrition and health issues and providing technical support to various ministries, Niti Aayog, FSSAI, etc. We welcome Dr. Rachita Gupta also to this webinar. We have Ms. Lopa Ghosh joining with us as one of the speakers. Lopa is the India Country Coordinator of Global Health Advocacy Incubator based in Delhi. GHI is supporting the initiatives in several countries in eliminating the trans fat. Lopa works with a diverse group of civil society organizations, opinion leaders, and media to build a national narrative on the urgency to save lives through hypertension control and trans fat elimination from food. Lopa also was with UN during that tenure. She was part of momentum building for the achievement of the MDGs and the SDGs. We are happy that Lopa is joining with us. I welcome Dr. Lopa Ghosh also to this webinar. Now I will invite the speakers one by one. As informed earlier, we request you to limit your first round of presentation, no need of any PowerPoint, to 7 minutes. Then we will come back. There will be a time for questions and answers. We will come back to the panelists with the related questions. First, I will invite Dr. Sunil Bakshi. Sir, being a representative of the regulatory, can you tell us more about the efforts made by FSSAI in eliminating the trans fat from India by 2022? And where we stand at this point of time, and also whether the FSSAI face any challenge in terms of the cooperation from the industry, or whether you are facing any opposition from the industry, and whether you are hopeful that we will achieve this target by 1st of January 2022. Over to you, sir, Dr. Sunil Bakshi.
Thank you, Mr. Cheriyan. I think I may have to switch off my camera for some time if the signals go down. So a very good afternoon to everyone, all the panelists and the participants in this webinar. First of all, I would like to thank the CUTS International for organizing this important seminar on the important issue of TFAs and for inviting me as a panelist. So I think the issue of trans fatty acids and its impact on health is not new to anyone. And as you have rightly said, that the non-communicable diseases, how they can be impacted by this emerging pandemic that we have, and what negative impacts it has on the health of people is very well known to all. So therefore, all of us have to be very cautious about our health. and in particular about the non-communicable diseases that we are concerned with. So coming to the regulatory, coming to the initiatives that the Food Safety Authority has been taking, I would say that it has been a mixed bag of initiatives that Food Safety Authority has been working on since last so many years now. And as you said, the Ministry of Health had been working on this right from 2009 itself. So the initiatives that we have been taking, I would say that these are pertaining to the regulatory aspects, and then also sort of encouraging or promoting the industry to follow these regulations, and also to take certain initiatives at their end so that the trans fats could be brought down in the products that are available to the consumers. And at the same time, we are also trying to make people aware of these issues of trans fat and impacts on the health through various initiatives under our Eat Right India campaign and all that. I will briefly summarize what we have been doing in the case of regulatory aspects. Is that currently, as you said, that there is a limit of maximum trans fats, which is 5% specified for 4 types of products, which is vanaspati, bakery shortenings, margarine, interesterified vegetable fats and oils. And the current proposed regulation that is, I would say, at the final stage of being notified. It has been already finalized, it has been already approved by the Food Authority, and now it is awaiting government approval, and which I'm expecting that we'll get the same within a month or so. So once this notification comes into place, this 5% limit of TFAs, which is currently applicable to only 4 products, will be applicable to all edible vegetable oils, and including these fat spreads. And then again in this regulation, we are proposing that we'll bring down this TFA, trans fatty acids content in all these vegetable oils and fats to a level of 2%, but that will be in a phased manner. We'll be getting it down to 3% by 1st of January 2021, and then to 2% by 1st of January 2022. And here again, I would also mention that these limits will not be applicable to any crude or raw oils, which are not consumed as such. Then this was pertaining to the vegetable oils and fats. There is another proposed regulation which is also being finalized and which will follow this first amendment regulation, in which we are proposing that all food products which contain vegetable oils and fats, they will have not more than 2% of this trans fatty acids based on the content of the oil that has been used in those products, which is that if oil and fats are used as an ingredient in those products, then the TFA content of those food products will not be more than 2% of the oil or fat content in that food product. So practically with these amendments, there would be a TFA limit specified for all food products that we consume. In addition to that, currently in the labeling regulations and in the regulation on advertisement and claims, first I'll say that in the labeling claim regulation, there is a requirement to declare the quantity of trans fat on every package of edible oil and fats and foods containing edible oil and fats as ingredients. So what that means is, even if the limit is set at 5%, but if the food product is containing trans fat content less than that, so that has to be declared on the label of the product. Then in case of advertisement and regulation regulations, advertisement and claims regulation, we have provided a provision of declaring a product trans fat free provided the food product does not contain trans fatty acids more than 0.2 grams per 100 gram or 100 ml of that food. And in case of oils, this limit is 1 gram per 100 gram of oil or 100 ml of that oil or food. So if the trans fat content in the food and the oil is within these limits, then the label can have a claim that these are trans fat free. In addition to that, we have also issued a direction for food establishments serving food that they can also use a logo which signifies that the food is trans fat free, and that logo is voluntarily it can be used, and it also specifies that if the trans fat content in the food is not more than 0.2 grams per 100 gram of the oils used, then they can declare, they can have that logo displayed on the label of the food as well as in the establishment. This was the regulatory part of it. But as I said, that we have been talking to the industry also, and very closely collaborating with them. And as is already known to everybody, that many food industries have taken a pledge with us that they will reduce the trans fat content in their food products by 2022, which we have already declared earlier, and which will be 1 year ahead of the deadline specified by the WHO. In addition to that, we had in 2018, we had launched a mass media campaign, Heart Attack Rewind, which was a 30-second public service announcement with the aim to create awareness and harmful effects of trans fats by reducing acceptability of industrially produced trans fats and building public support for government action to eliminate industrially produced trans fats, and also leading consumers to the FSCI website to seek more information about trans fats. So these are certain initiatives which have been taken by the Food Authority. And regarding the challenges that you mentioned, yes, we know that practically, I mean, there has been a lot of difficulty in the working of all the spheres everywhere in every organization because of the emerging pandemic. So the deadlines that we have set for reducing the trans fats as per the regulation, we might face some challenges in that. But as far as the industry is concerned, I don't think we have faced any challenge from the industry because we are collaborating very closely with the industry. And as I already mentioned, that we have already taken a pledge together with the industry that there would be every effort will be taken to reduce trans fats in food products by the specified deadline. That's all for the time being, I would say, and it's over to you now.
Thank you for, sir, for elaborating in detail about the efforts made by FSSAI, mainly with regard to the regulations, and also mentioning about the overcoming the challenges and the present status. There are few questions. We will come back with the questions later once all the speakers are over. Dr. Longwa had informed us he regretted. I think one of his colleagues met with an accident, and so he's not in a position to join. So now I invite Dr. Iram Rao, mainly based on her expert as a technical expert, to tell us more about the cost-effective alternatives for the trans fat, mainly of fats, oils in food sector. Over to Dr. Iram Rao.
Thank you, Mr. George, and good afternoon to all the participants and my fellow panelists. It is my privilege to be part of this particular panel, and I'm really happy to learn that everybody is putting their hands together, be it the regulatory body, Food Safety Authority of India, agencies like CUT, Voice, etc. We all are together in this particular mission of eliminating trans fats completely by the deadline, if not by 22, but at least by 2023. So I'd like to first talk about, what is the consumption pattern of the Indians, as we know that all of us love to snack. If you look at the data, it says that it's just not the fried food and the bakery food items which are of concern, but besides that, we are, a population which loves mithais, and all our sweet meats, so-called mithais, are full of trans fats. If you search for the data, it says that, amongst the low income group, industrial laborers and the urban slum dwellers, it is the maximum, trans fatty acids are maximally consumed by them in the form of snack foods, which is like, pakoras, etc. In fact, they are dependent on those particular meals like chola bhaturas, etc. for their, for their meals. And also a lot of mithais and snack foods are being consumed. So coming to the question of the cost effectiveness, let me first tell you that what are the alternative approaches to the trans fat. So as we know that currently what we're using is hydrogenated vegetable oils, which are popularly known as vanaspati. Now, this vanaspati has been a replacer for ghee. So if you look at somewhere in the early 60s, ghee, or clarified butter as we call it, had become extremely expensive, and an alternative was sought for it. So this particular alternative fitted very well in place of ghee. So in the earlier days, people used to make mithai with ghee and also fry their puris and namkeens in ghee till it became unaffordable. Now, the partially hydrogenated vegetable oil had the right kind of physical properties which fitted very well when it was used as a bakery shortening, when it was used as a, as a shortening agent elsewhere, maybe in your puris, parathas, as well as for the frying medium. So what are these physical properties which we are talking about? When you take butter and when you cream it, it gives you that particular softness, or the product which comes out of it is very light. It crumbles and it is very, very, enjoyable, or it's very, very tasty and palatable. So this vanaspati was the excellent fit for your butter or for your ghee. Now today we have heard about all those concerns that just not CVDs, also diabetes is one of the reasons, because we are suffering from a whole lot of non-communicable diseases. So then the big question is, do we have an alternative for these particular fats which are called as trans fats? Certainly we have trans fats, as mentioned by Mr. George, that a vegetable oil is hydrogenated to give you a particular product which is called as vanaspati, which we call it as partially hydrogenated vegetable oil. Now, one of the first ways of modifying this is to increase the degree of hydrogenation and completely hydrogenate this particular fat. So this gives you two outcomes. One, you have a low trans baking alternative or a shortening agent as we call it, or we may also get a zero trans baking fat. Both these things are a good alternative. They're extremely cost effective also, because you do not have to switch the process parameters. The same plant which is producing vanaspati can now switch for complete hydrogenation and give you a fat which can fit into that particular space. Except for the fact that we are also concerned about the total amount of saturated fatty acids as well. So in this case, what happens is the fat becomes hard because it's completely solidified. So it loses some of its physical properties because it's become extremely hard. So the alternative is it can be also blended with a particular vegetable oil. So it gives you that plasticity which is required by the baker, or it is required for a person who's making, let's say, namak paras or parathas or puris, where you want to use it as a shortening agent. So this is one particular alternative, and the functionality of the fat is not then compromised. So this is very cost effective, as I said, because you do not switch the process parameters. The same industrial plant can manufacture it. Number two, we have interesterified fats. Now, interesterification is a process which can be achieved either by a chemical means, or it can be done through an enzyme also. So enzymatically also you can produce fats which have the same functional properties or the physical properties as that of your butter or your partially hydrogenated vegetable oil, but it does not give you the trans fats. Except that this is slightly more expensive as compared to the modification and the hydrogenation process. So interested fats, in fact, are the way forward. You can make spreads out margarine, and you can also have bakery shortenings. Now, the industry is working a lot on these particular food ingredients. So, for instance, if you want to make cookies, you want the cookie should be it must have the right volume, or it should have that particular texture which is enjoyed. So, you have trans fat free bakery shortening, which can be obtained using interested fats. And what they do is they flush nitrogen gas into that. So what my Vanaspati was giving was because of hydrogenation. So there you would have 12% of it, which gives the volume to my product. In this case, you have an alternative where you have an interested fat, which can be then infused with nitrogen gas. So your resultant product would be, in fact, even better than the product which is made with Vanaspati. When it comes for a frying medium, I think the switch is very easy. We can alternatively, instead of frying the samosas, jalebis, and pakoras in Vanaspati, I'm sure all of us know that vegetable oils are equally good. This I've said is slightly expensive. So it's going to be 5 to 10 rupees more expensive as compared to your Vanaspati. The third process is where we are actually skimming off the solid fractions from the natural oils. Now, what does that mean? So you have coconut, or if you have palm oil or palm kernel oil, what you need to know is it is the melting point of the fat, which is extremely important. So melting behavior and crystallization behavior are the key functional properties which a baker or a processor is looking for. So what you do is you take a vegetable oil. Once it cools down, or once it comes to the room temperature, you can skim off the solid fractions, collate them, either use them singularly, or you can blend them alternatively with 2 or more varieties, and you can have an alternative fat which is going to be trans fat free. So these are the 3 alternatives as we speak. They're extremely cost effective, and look at the gain which you get. So what we are talking about is that we also need to build what is called as consumer awareness. So together with the regulatory body, with the academics or the academicians and the institutions doing research on that, with doctors talking about the ill effects, nutritionists advising diets which are supposed to be trans fat free, food processing industry working day and night to bring down the content of the trans fat and one day perhaps achieve what is called as zero trans fat free products. We need to also bring in a behavioral change which Food Safety Authority is doing through the Eat Right movement to cultivate the demand-driven sector where the consumer says no to the trans fat. So the way forward is going to be this multifaceted approach where all stakeholders come together on the same platform and ask for a product which is healthy, it is safe, it is nutritious, and not compromising on the palatability of the product. Thank you, Mr. George.
Thank you, Dr. Iram Rao, for explaining in detail about the cost-effective alternatives to trans fat, and a little bit explaining the process as well. And also you have underlined the need for the consumer awareness and the behavioral change to happen to achieve this target. I think in the absence of Dr. Longwa, you have mentioned a little bit about the science behind the TFAs also. Thanks for that informative talk. We will come back to you with the questions later. Now I invite Dr. Rachita Gupta mainly to talk about the replace, which was announced by WHO in May 2018. What is the status of the replace, and what is the status of various countries in achieving? How much WHO is hopeful about achieving this target by 2023? And also, in case if you have any comments on the process in India. Over to Dr. Rachita.
Thank you so much, Dr. Cheriyan, for the kind introduction. Good afternoon to all the panelists and the participants, and it's very encouraging to see such an enthusiastic participation for today's webinar. I would be talking about the WHO's replace package. So as you would be knowing, WHO has been advocating globally for elimination of industrially produced trans fatty acids from the national food supplies at country level. As Dr. Cheriyan had mentioned, it is recommended that the total trans fatty acid intake be limited to less than 1% of the total energy intake, which comes to roughly 2.2 grams per day in a 2000 calorie diet. However, in India, partially hydrogenated oils have been reported to contain 6 to 30% industrially produced trans fatty acid, which clearly exceed the recommended limit of 2% of total fatty acids. These are often used in preparation of commercially produced savory snacks and sweets, which are commonly consumed in India, as mentioned by Dr. Iram in the previous presentation. We can eliminate almost 7% of cardiovascular diseases globally by simply eliminating artificial trans fats from the food chain, which is a low cost investment. And this is the precise reason why it has also been identified as one of the 16 best buy interventions for tackling NCDs by WHO, given the fact that these are the most cost effective and also feasible for implementation. Coming on to replace is basically an action package which has been developed by WHO that supports government to ensure the prompt, complete and sustained elimination of industrially produced trans fats from the food supply. It was launched by WHO during a high level event on the 14th of May 2018, and it provides a practical step-by-step implementation information to support governments to eliminate industrially produced TFAs. Replace modules are basically there to support national policy makers and food control authorities in developing and enforcing mandatory trans fatty acid limits. I think Dr. Lopa would be touching upon more on the global best practices, wherein some countries have enforced mandatory trans fatty acid limits and some have enforced a voluntary limit, and the pros and cons of both. So replace basically outlines 6 strategic actions focusing on 4 broad areas. These are promotion of use and consumption of healthier fats and oils, elimination of industrially produced trans fats through regulatory actions, establishing solid monitoring systems, and lastly, creating awareness among policymakers, producers, suppliers, and the public. This is something of a process that India has already adopted, as explained by Mr. Bakshi. And so we are in an advanced stage in eliminating industrially produced trans fatty acids in the country. So as Mr. Cheriyan had mentioned, replace is basically an acronym which is basically containing 6 modules. RE stands for review, which is basically a guide for landscape assessment and roadmap development for elimination of trans fats. P stands for promote, which is a guide for determining best replacement oils and interventions to promote their use based on the local landscape, availability, costing, etc. L stands for legislate or regulate, which guides development of a trans fat policy action. A stands for assess, which is basically a guide for trans fat surveillance in the country. C is for create, that is to create trans fat awareness, something that, as Dr. Iram and Mr. Bakshi mentioned, is being done through the Eat Right movement in India, as well as through the trans fat free logo and other interventions. E is for enforce, which is basically to guide trans fat policy and enforcement of regulations. So WHO basically expects the food industry to actively contribute towards trans fatty acid elimination. It is expected that the industry reformulates foods to eliminate industrially produced trans fatty acids while simultaneously not increasing the saturated fatty acids. So we need to ensure that we are not killing one devil and giving rise to another devil. And what has been also observed is that at times manufacturers have different quality levels in different countries. There are certain countries which have more stringent regulations, monitoring and enforcement, and therefore to comply with those regulations, they provide food products which are in compliance with those regulations with a lower trans fatty acid limit. However, the same companies and the same products, when tested in other countries which do not have such strict implementation of regulations, there it has been seen that the trans fatty acid content appears to be higher when tested. So that's something that needs to be ensured. Also, industry is expected to support small and medium-sized enterprises by sharing knowledge. So learning is important. This can be done through setting up of repository of methods and technological innovations and providing technical support as required for reformulation. Sometimes you just need champions. So bigger manufacturers in the industry can champion the cause and show the way to the smaller and medium-sized enterprises. Industry is also expected to increase the supply of replacement alternatives, low and saturated fatty acids by oil and fat manufacturers to support the enforcement of elimination of industrially produced trans fatty acids. So there has to be supply and there has to be demand. So both the things have to go on simultaneously when we are talking about replacement oils. Also, industry has to implement the trans fatty acid labeling on prepackaged foods by specific timelines. I think that is something that India is already progressing on with the labeling regulation, and we should hopefully have a front of pack label sometime soon. Lastly, the industry is also expected to support implementation of periodic independent evaluation to monitor progress and achievement under the commitments made. I don't know if you would recall, it was in 2018 that the industry had made, several industry representatives had made voluntary pledges to reduce sugar, salt, fat, trans fat content in their products. However, we have not heard back as to what has been the progress against those voluntary pledges. So not just the voluntary pledges, but also the regulation. Even for the 5% regulation, we really don't have much data in hand as to what is the current situation with regards to the compliance by the industry with that 5% regulation. So it's important that while we are enforcing and implementing regulations and voluntary pledges, we also need to seek data to ensure compliance. Just to finish, I would like to say that translating replace action package into practice in India, we have already moved ahead with the regulating, limiting artificial trans fats in oils and foods as explained by Mr. Bakshi. But moving forward, India needs to strengthen the assessment to accurately trace trans fatty acid levels in products, including building standards for labs, capacity for assessment, and ensuring quality assurance for accurate testing. I think that is one of the biggest challenges that lies ahead of India. Once we have the regulation in place, how are we going to ensure compliance? How are we going to test? Are our labs capacitated to do that and provide us good quality results? That's something that India needs to invest on. Also, we need to design and implement an appropriate inspection strategy to assess compliance to TFA regulation. And lastly, we need to set up information systems and track indicators to compliance and non-compliance by sector, region, etc. So that's the way forward that I see when we move on after the regulation. Thank you so much.
Thank you, Dr. Rachita. You have explained in details about the replays and what the replays is expecting, mainly from the industry and some of the challenges or the measures to be taken by the regulator. We will come back to you with the questions later. Now I invite Dr. Lopa Ghosh for her talk. Lopa, GHI work in various countries in supporting the efforts for achieving this target. Can you tell us some of the international best practices and also the progress made in India based on your experience in working with various partners at the state level as well as at the national level? Over to Dr. Lopa Ghosh.
Thank you, George. It's such a pleasure to be here and to hear from all our esteemed colleagues. The good thing is that TFA is like one small family because all of us seem to be working together on this rather niche but important issue. In fact, sort of drawing from what my other colleagues have been sort of presenting earlier, that the current health crisis is actually an opportunity for us to do our bit to make food systems safer. And across the world, there is a lot of momentum on eliminating TFA because it is seen as something that is achievable. In our work at GHEI, we've actually had the opportunity to work with a number of countries across the world. And I should mention here that as a result of the WHO call to replace action, which Rachita talked about, nearly 1/3 or 2.4 billion people in 28 countries actually have brought about mandatory trans fats limits or bans on partially hydrogenated oils. Since the beginning of 2018 alone, which is when the replace package was announced, mandatory TFA limits have come into effect in 8 countries and passed in additional 25 countries. Yet, of course, there's a lot more work to be done because more than 5 billion people, that's 2/3 of the world's population, live in countries that don't yet protect their citizens from the harmful effects of TFA. But what's interesting in our work across the world is that countries as diverse as Denmark, Saudi Arabia, Chile, Thailand, Slovenia, despite the inherent culinary and cultural diversity, TFA elimination seems to be possible if there is political will, of course, and through 2 simple policy solutions that seem to do the work. So either you limit industrially produced TFA to 2% of total fats, oils, and foods, or you ban production of PHO completely. So depending on the country context, both these options seem to work very well. I'd, of course, like to take the opportunity to give you a flavor of a few of our country experiences. In the interest of time, I'll pick a few success stories and also talk to you about some instances which require more work. Of course, it's only right to start with Denmark, which is considered we all know about it, about their success with eliminating TFA. It's considered a gold standard. Way back in 2003, they enacted the 2% limit on fats, oils, and food. But their actual work started in the 90s, when around 1993, 1994, they started sort of thinking about the ill effects of TFA in foods. And there were surveys done, and a very robust baseline was created where they tested their very popular baked goods like Danish pastries, etc., to find the amount of TFA in all of those food products. They also looked at which of the population groups were most impacted by it. So in fact, something that Rachita and Dr. Aram, they both mentioned, that having that kind of baseline understanding of TFA amounts in our food and food system is very important. So by 2003, of course, they had limited TFA to 2%, and implementation also was very successful. Some of the reasons why they achieved all that success was political will, plus they worked with industry to overcome the industry pushback. Industry pushback is only expected, but if you work with industry and find good replacements and find pricing solutions, then obviously that is overcome. They've also always set up very good testing capacity and enforcement skills and powers across the supply chain. Very different from the Denmark experience would be a country like Chile, which it's more recent, but it has also done remarkably well despite the many inherent challenges of the country. What Chile did was, they took a consultative approach, and once again, very strong political will, but they worked across sectors. And the Ministry of Health, when they got a pushback from the food industry, instead of providing sort of where the pushback was because of price increase, etc., the argument was pivoted on the healthcare cost that would result from TFA consumption. So it was basically a nationwide concern regarding NCDs and disease burden and doing something good for the health of the population. So in 2006, they mandated TFA labeling, which was followed by 2% limits in all foods in 2009. Compliance in Chile is supposed to be very, very high. Even though resources for enforcement is very limited, they seem to be complying almost 100%. Small producers of baked goods had, the small and medium size, they have faced greatest challenges. but the government and the larger food industry, they worked hand in hand to ensure capacity building. Chile is in fact now planning to go one step further and adding a PHO ban. Very different culturally would be a country like Saudi Arabia. So Saudi Arabia initially had implemented mandatory TFA labeling along with 2% limits in 2015. But in 2018, it actually enacted a PHO ban to be aligned with the WHO prescribed international best practice. Major food companies had already ceased using PHO, but this ban obviously helped improve the elimination status per se. And FDA works very closely once again with small and medium companies, food manufacturers, in implementing the TFA requirements. As of February 2018, 94% of products sampled by FDA were found to be in compliance with TFA limits. The case of Slovenia, for instance, in Europe is also very interesting. Their TFA burden had gone up higher because of imports from other countries. So at that time, EU had not yet sort of imposed a TFL limit. So Slovenia decided to go ahead and create its own TFL limit and has been doing extremely well. Some of the countries, of course, where it hasn't worked so well would be a country like South Africa, which again went about regulating TFA without probably having a very firm understanding of the baseline. That, which are the foods that are high, what is the requirement, what is the production and consumption pattern. So although it has enacted a 2% limit in fats and oils in 2011, enforcement continues to be very weak and there is not much compliance as of date, as we understand. The case of Argentina, however, is a little different. Because of the nature of the policy that they sort of enacted, which was 2% limits in fats and oil, for direct consumption, they only covered packaged goods. They left out the entire informal food sector of unpackaged goods, as a result of which, about 65% of food consumption or food, production does not comply with TFL limits. We are, of course, working with them to ensure that this major loophole is addressed. More recently, Brazil, Turkey, in fact, last week, Philippines also has, started on this journey of TFA elimination. What we feel from all of these experiences is that there is one lesson to draw. The policy solution is rather simple and can be easily implemented if a country follows either or placing limits on all foods, fats, and oils, therefore covering all possible types of entry of TFA in the food system. And that is very relevant for complex countries like India, or placing a PHO ban, which is something that various states in the US or Canada or Thailand, they took that approach of placing a PHO ban. However, the impact of these policies are fully realized only if enforcement capacities are in place. And there is a great deal of hand-holding from the government and from the bigger food industries and also from technical experts on hand-holding the small and mid-size food companies, plus finding technical alternatives, and of course, eventually what's very, very important is basically to have the consensus and buy-in of the industry. This is all I have at the moment, George. I'm happy to take more questions.
Yeah. Thanks, Lopa. We will come back with the questions. Thanks for explaining, sharing with us the experience of DHI in working in various countries and how these countries were able to achieve either the elimination or the reduction of trans fat. Through the chat box, I have already received some of the questions, so I will raise those questions with the concern. I will start with Dr. Bhaji. The first question is, you have mentioned that the regulation for setting the limit to 2% in oils and fat will be notified soon. But until and unless we set the limit of 2% by weight in all foods, we won't achieve the elimination of trans fat. So what is the status of this regulation, and what you think that is delaying setting the limit of 2% in all foods? That is question number one. The second question is with regard to the present compliance status. As you have explained, the limit of 5% was decided in 2014 to achieve by 2015 and 16, and 2017 onwards it has to be 5% limit. But where we stand now, whether FSSAI is having any data or the baseline in terms of compliance of this 5% limit. So I will limit with these two questions at this point of time. Over to Dr. Pachi.
Thank you, Mr. Cheriyan. In respect of the first question, that what is the status of limiting the trans fats in the foods also at 2% level? As I said, that these are two different pieces of amendment regulation, while as the one which sets this 2% limit in all fats and oils is almost, being finalized. It is awaiting approval from the government and will be notified, as I said, within a month or so. The second regulation is also following very closely, and this has been already cleared by the scientific panel, the finalization part of this regulation, and it will go to the scientific committee for discussions now, and thereafter it will be approved by the Food Authority. So I would say that within a timeline of around, say, 6 months, this should be also in place. These two regulations are following very closely and will be notified soon. Then on the issue of the compliance, I think Dr. Rachita and Ms. Ghosh, they have rightly pointed out that compliance is something which is necessary, and unless we know what is the status of what we are doing and what is the status in the field, so setting up regulations is not just enough. I would say that on this front, we are going to make surveillance a very integral part of our overall this management of the food safety system in the country, food regulatory system in the country, and so surveillance is going to be an important part of it. In fact, I am told that some survey was already conducted in the month of April or May, but the results, I don't know, they are not available with me, and there were some practical difficulties that were encountered during those, during that surveillance. But from now onwards, in fact, yesterday also we had a discussion within the authority that there has got to be a regular surveillance done on all these important products which are important in terms of the risk as far as the safety is concerned, or which are more prone to sort of adulteration and all that. So there would be a regular sort of surveillance, both at the Food Authority level as well as the level of at the level of the state food enforcement agencies. And this will be these surveillance activities will be carried out in a coordinated manner. And I think oils and fats is something which is immediately on our radar for the surveillance, and we might be initiating taking samples of oils and fats across the country very soon, though I may not be in a position to give the exact timeline when it is going to be done. As far as the enforcement of the regulations is concerned, as you know that as per the Food Safety and Standards Act, though we at the central level, the Food Safety Authority, we basically frame regulations, and the enforcement of these regulations is a joint responsibility of the state enforcement agencies as well as the Food Authority. So all directions are being given to the commissioners of food safety in respect of what are the sensitive commodities and what is to be seen and how what actions are required to be taken. So all that guidance is being given to them. And at the same time, as you know, that many of the food business operator licenses are being issued at the central level also. So we are going to have our own food safety officers also. So the enforcement is going to be strengthened in future in a very big scale. Over to you.
Yeah. Thank you, sir. Thanks for explaining about the status of the regulation in all foods, as well as underlining the need for the strong enforcement. Now I have two questions to Dr. Eram Rao. One is, you have spoken about the cost-effective alternative to trans fat. What about the palm oil? Whether it is healthy, because this question is raised across the people, and the consumers are having a great concern about that. Can we use palm oil as an alternative? That is number one. Number two is, you have spoken about the Kerala model of making the bakery products trans fat free. We also did a document about that and developed a case study and written a couple of articles about that. What do you think that it is the hindrance? If Kerala can achieve it, what is the problem in replicating it or scaling up to the national level? Why it is getting delayed, and what you think that is the main hindrance in scaling up this model? Over to Dr. Iram.
Thank you, Dr. Cheriyan. I think very good question. I've been reading also that a lot of people want to know that how good palm oil is like. So to begin with, let's remember that all vegetable oils, no harm. We are today talking about trans fat free. So if you're replacing your PHV, partially hydrogenated vegetable oil, that's your vanaspati, with palm oil for frying as a medium or as a cooking medium, I think it's a good alternative, right? Now, having said that, one concern which we have is trans fat reduction. As we speak, it is 5%. We are aiming to go down to 2% and eventually get rid of it completely, like WHO is asking the world. Now, in that context, you have to also remember that the total saturated fatty acid content of your diet should not exceed 10%. So in that context, if you're replacing all of your fats, so when you recommend eating healthy fats, that includes saturated fats, monounsaturated fats, and you have polyunsaturated fats. So I'm supposed to have a ratio of roughly 1:1:1. So if I completely replace all the variety of fats only with palm oil, then that's a cause of concern. And that's how you have to then include other varieties of fats like MUFA, that is, your medium, your unsaturated fatty acid, monounsaturated fatty acid, my apologies, and polyunsaturated fatty acids. So that's the case with that. Now coming to the Kerala model, that was an extremely well thought of a model. And as we said that, when we worked with the Kerala state, the state wanted that to happen. So it put all its machinery together with the Food Safety Commissioner, the FDA body, with the health professionals, as well as with the bakery associations and with the small and the medium enterprises. They came forward to ask for solutions for replacements. And why that model per se worked was that they were eager for this hand-holding. So, one thing is that to suggest a replacement. The second thing is what the person who is producing the food is always concerned is not to compromise on the taste, palatability, or the acceptability of the product. So when you replace your vanaspati with, let's say, non-traditional fats, which I have recommended as maybe your interesterified fats or other alternatives like total hydrogenation, then you want to have the behavior of the fat just like your vanaspati. So once they were given that demonstration, they were made to taste those products, right? And they realized there's no difference between the two, and also the cost effectiveness that had to be underlined to them, that this really does not increase the cost of the product so much. So it's not going to pinch the consumer. And again, we also worked with the, with the department which was responsible for conveying to the consumers that eating healthy is actually investing in your health. So if I pay, let's say, another 2 rupees or 3 rupees for my samosa or for my mithai, at the end of the day, still it is much less, it's less cost effective, or it's more, cost effective when you go have to use your medicines instead, So that particular thing really went down well with them. Now the question, what's happening to the other states? The other states, need to be really nudged, right? And I think the initiative has to be taken from, as Mr. Bakshi also pointed out, his work is to make beautiful regulations. It is the machinery of the state which has to actually muster the courage, I would say, to go out there, pick up those particular food products, challan a few people, right? And that's how we can actually make them conscious and aware that we are looking for alternatives of fats. Thank you so much.
Thank you, Dr. Rao. Now a couple of questions to Dr. Rachita. You have explained about the replace, and what I could understand is you are giving more importance to the industry to self-regulate and to cooperate. How much this is possible, and what is the information that you have about this? Second thing is, in the replace itself, the create awareness, it is including the public, the consumers, like. So whether WHO is having any focus on that, because I have not heard about a plan for creating massive awareness among the consumers about the ill effects of trans fat, generating the consumer demand. That is the second thing. And the third thing is, what is the status of replace? We were actually expecting the annual status report of replace. Whether you have any information, I was reading somewhere 166 countries had already initiated the process at various levels for eliminating the trans fat. So whether you have any data or information on the status, the global status with regard to eliminating the trans fat. Over to Dr. Rachita.
Thank you, Mr. Cheriyan. So I'll go one by one. So your first question on how much the industry should be involved vis-a-vis the regulatory part. In context to India right now, Mr. Cheriyan, as I had highlighted, while we do have a 5% regulation, but how much of it has been enforced, we do not know, because we do not have any data on compliance. And we are basically relying on the industry to self-comply to the regulation. So that's why my focus was on industry, that yes, there is a need for a regulation, essentially to give a level playing field to the industry. Because until and unless you don't have a level playing field, the cost factor will always push the industry to use cheaper alternatives like PHVOs. However, still, industry has a major role to play. Like I said, until and unless the industry doesn't go forward and produce healthier, safer, and cheaper alternatives for PHVOs, you really can't progress further. So industry does have a role to play. They are the ones who need to comply to the regulations. They are the ones who need to comply to the labeling regulations as well. So it is a public-private partnership that is required in this case. Moving on to your second question on create awareness and WHO's mandate on that. So WHO essentially does not have mandate on behavior change communication. As part of our mandate, we do provide technical support to the government to create content for behavior change communication campaigns, but that is not part of our core mandate. So we do have global communication material that can be adapted at the country level. So that's readily available for use in India as well. Coming on to your third question of the global status report, well, yes, that's awaited, and it should be out in a couple of months. There has been some back and forth, and that should contain the update on the current implementation with regards to TFA regulations and the replace package. Thank you.
Thank you, Dr. Rachita. Now I have a final questions to Dr. Lopa Ghosh. You have shared with us about various country uh, practices and also briefly mentioned how they were able to achieve it. You have spoken about Denmark, Chile, South Africa, Slovenia, Argentina. With regard to Denmark, you said it is the political will which moved the thing. With regard to Chile, you have mentioned that it was strong compliance. So what do you think that it is lacking in India, in taking this forward, or you think that, India is moving in the right direction so that we will be able to achieve the target, or based on, working in various countries, what is your suggestion with regard to India? Over to you, Lopa.
So very good question, actually, George. Thanks for that. So India has actually taken all the right steps, and as always, I think the policies, as Dr. Eram mentioned, and Dr. Dr. Bakshi kindly sort of gave us an update on the status of the regulations. We are very good with creating fantastic policy frameworks, and we are known globally for having like beautifully written, beautifully crafted, starting from the constitution to the TFA regulation. I think it's absolutely world class. But the challenge of enforcement, I think for a country as diverse as India, we have to be empathetic and we have to be sympathetic to the fact that it's not going to be an easy job. One of the ways, of course, once the regulation is done, then enforcement, and therefore ensuring that the food safety, there's enough capacity building out there across the levels of the supply chain. But I think a little bit of hand-holding, and that is something that we have seen in other countries as well, a little bit of hand-holding and sharing of technical solutions. So for instance, when we are talking about the success of Kerala, what has worked there is basically because they have been able to come up with the alternatives to trans fat, how to ensure that it remains competitive price-wise, and yet the taste is not affected, and it's easily available for the small and medium-sized food vendors. So I think it is essentially determining those solutions first that would really help us quite a bit in delivering on the promise.
Thank you, Lopa, for that response. Now we need to conclude the question and answer session. Before I invite my colleague for summing up, any of the speakers want to make any final point if they have missed, or based on the response of the others, anything want to add? Then 30 seconds each we can use for that. I think Dr. Iram is having a point to mention.
I just saw a question stating that, what I forgot to also mention is that trans fats would be also made when you reuse oil, multiple times, like frying and refrying of oils. So just to give that suggestion that, we are not ideally supposed to be like reusing the fried oil. In case of domestic use, we cannot even think of throwing it off or discarding it as a precious commodity. So we need to have, to actually use that oil, filter it and keep it in an airtight container, and maybe use for making gravies or other vegetables, etc. But in case of large business operators, there are strict rules for that, so they need to comply to that. And there are guidelines set out even by the Food Safety Authority of India. So you need to abide by that. There are collection centers where this oil can be collected and used for biofuel. So people who want more information on that, I would suggest that please read up on the Food Safety Authority of India website to get those details. Thank you, Mr. Cheriyan.
Yeah, thank you for sharing that information. Now I request Dr. Bakshi to say a final word.
Just to add that, as Dr. Iram mentioned, that the issue regarding the reheating of oils many times. In that case, in fact, we have already mentioned in our licensing regulations that these oils being used in food products should not be used heated more than 3 times. But that is a bit subjective, and more objective regulation in this case is that we have set a limit of total polar compounds in these reused oils. So if that limit is exceeded, obviously that that oil cannot be used for any preparation of food product then. And on the second question, which Dr. Rachita raised about whether our labs are equipped to carry out the testings to estimate what is the level of TFAs and all that. Here I would like to mention that we had a very big scheme of upgrading all our laboratories, and which was a centrally sponsored scheme. And under that scheme, all the state food laboratories and other government laboratories, they have been provided necessary funds to upgrade their equipment, their manpower, and very state-of-art equipment has been made available to these laboratories. And besides that, as we have also a network of private laboratories, almost 160 or 170, which have been recognized by the Food Safety Authority. They are NABL accredited, and they are very much fully equipped to test such products for TFAs and all that. Thank you.
Thank you, Dr. Bachi. Dr. Rachita, you want to say anything?
No, thanks, Dr. Cheriyan. Thank you.
Yeah. Thank you. Lopa, you want to add anything or?
No, thank you. George.
Thank you, Lopa. Now I invite my colleague Madhusudan Sharma to sum up the discussion and propose the vote of thanks. Over to Madhusudan.
Yeah, thank you, George. Actually, I was the patient listener of the whole discussions, and I was thrilled to listen all the discussions, and I could realize that the range of issues we discussed today were quite long. If I talk, if I list them, these are going more than 30, 35. The keywords I noted, but I will briefly talk about the key things about which talk. In the initial introductory remarks, Mr. George Cheriyan talked about the global and Indian data and statistics about TFAs, the comorbidity and the health harms also he touched upon, and he also talked about the related regulations of the trans fat. Then Dr. Bakshi talked about the regulatory interventions which are being taken at FSSAI level. He also talked about some very popular campaigns which are initiated by FSSAI, and also he talked about various amendments done in various regulations. Then we also heard Dr. Iram Rao. She very nicely, she touched upon the sources of trans fatty acids. She also talked about physical composition and the properties of industrially produced TFAs. She also talked about alternative approaches which are being used and the key stakeholders of trans fatty acids. She touched upon the various key stakeholders which are playing their role in this whole sector. She also underlined the importance of awareness and the behavioral change in this whole the initiative, or in the whole domain of trans fatty acids. We also heard Dr. Rachita, which very nicely defined, replaced its meaning, and touched upon the demand, supply side issues and regulatory issues and challenges. She talked about various voluntary pledges taken by the industry, and the compliance of all these things, compliance related issues also she touched upon. And then we heard Ms. Lopa. Actually, she touched upon various best practices. She shared with us about the Chile the model, the Denmark model. She also talked about the Saudi Arabian initiatives related to trans fatty acids, how they eliminated. And she underlined the key success factors also behind these interventions. He also underlined the political will, which need to be, the prime driver of eliminating of the success of such initiatives. Then we had very good the interactions during question and answer sessions, and I could realize that we had a barrage of questions from our attendees, more than 65 attendees. That they put very good questions, and all the panelists given very good reply. So in the end we could have what are the issues and the challenges related to reheating of oil. So I think these are the few areas, and there were other areas also on which we had very good discussions. The other thing I want to highlight is that today's this 1 hour and 25-minute discussions, we had various takeaways. We have noted all these things, and we will be preparing a report and sharing with all the delegates. With this, I want to convey our sincere thanks to Dr. Bakshi, who find time from his busy schedule and shared his experiences. I also thank Dr. Iran Rao, Dr. Rachita, and Dr. Lopa, and all the attendees. I want to give our sincere thanks that you came and posed very good questions. So we will be sharing the report of this webinar. So with this, I want to just close my remarks. Thank you, George.